Hello and welcome to another Commonwealth Conversation. This is We Virginians. I am Ryan Gilchrist. Today we're talking nonprofits, and especially about how nonprofits are trying to get by in this time of coronavirus and how that affects both their operations and children of Virginia. Joining us today, we have Chloe Edwards. She's the Outreach Coordinator, Voices for Virginia's Children. Welcome, Chloe.
Thanks for having me.
We also have Charvalla West, Chief Operations Officer and Director of Community Impact for the United Way of Virginia Peninsula. Welcome, Charvalla.
Great. I'm glad to be here. Thank you for having me also.
As always, my co-host is Marisa Porto. She's the Executive in Residence at Hampton University and a longtime newspaper editor and publisher. Hello, Marisa.
Good to see you all today.
So I know nonprofits have been a topic you and I have discussed quite a bit recently. Where would you like to start today with Chloe and Charvalla?
Well, I've talked with a number of nonprofit organizations in the last few months about the coronavirus impact. Maybe, Charvalla, you can tell us a little bit about what the United Way is seeing on the peninsula and the Virginia Peninsula and in Hampton Roads, and then we can talk about a statewide view.
Absolutely. So in April, we launched our emergency fund. And the first part of that fund was used for those nonprofit organizations meeting the greatest needs that came out of the virus outbreak to apply for funding to continue those services. And what we found was there were many nonprofits that were able to adapt their service delivery efforts to meet basic needs like food, shelter, healthcare, and things like that. And so we were able to, we've received a little over 30 applications thus far, and we've been able to mobilize resources to meet those needs. As the crisis evolves, we are also adapting our efforts. We're preparing that as the economy starts moving again, unemployment is no longer available to some folks, that things that may have been on hold before, like evictions, utility disconnections, things like that, would have been possibly piling up over the last few months, and there will be a great need for financial assistance. So we've begun mobilizing funding to meet those needs. We are doing so in partnership with government organizations like the schools and social services, other nonprofits, and just coordinating all of the resources that have been coming down from so many different areas to make sure that we are filling the gaps as we see them.
Chloe, can you tell us what you're seeing on a statewide level?
Well, yeah, from the beginning, Voices was just finishing up our 2020 General Assembly session, and it was very successful around cross-cutting issues like access to mental health, school counselors, increase in the schools, foster care, etc. And we were very excited about that. And then all of those items, many of those items are now put on pause as a result of the pandemic. So this shows how it's impacted our budget. On the ground level, I work on the campaign for Trauma-Informed Virginia, and I work with 26 trauma-informed community networks across the state, including the one that Charvalla is a part of. And with that being said, I've seen the attention of the network shift from now we're raising this trauma awareness, but now it's time to really implement all that we've learned thus far around trauma-informed care. The pandemic is a trauma in itself for families and children. As far as the needs of the community, we're seeing a lot of trends around just the basics, like how do we survive? How do we have food, clothing, and shelter? So food essentials for families has been a huge theme that we've seen. Voices has also shifted our work. We've worked at the local level. We're still working at the state level, but we're also working at the federal level. So with the HEROES Act being introduced, we're looking at SNAP benefit increases, possibly that can come out of the HEROES Act. Around childcare, we know that our childcare industry is the backbone of our work industry. Families and children need, with the schools closed, this has shifted to just childcare for essential workers in some facilities. But we know in order to support the workforce, we need to also make sure our childcare industries are resilient throughout this pandemic. So we've been blessed so far at the state and federal level to have that support from the feds and the state. But this is something we're going to continue to advocate for. And now the pandemic has also highlighted the importance of access to healthcare, the importance of sick leave, the importance of unemployment for families that need it during this time. So at the federal level, we believe that Congress must enhance federal financing for the Medicaid program by 12%. We want to ensure that families and children have healthcare access, especially since that's just such a prevalent need at this time. One of the policies that were passed in the 2020 General Assembly was Pot 40 quarters, which from the healthcare component, if an immigrant comes here and does not have 10 years of work experience, they do not have access to health insurance. And this was something that had passed during the General Assembly. That funding is now put on pause, as well as FAMIS moms for low-income mothers as well. A personal friend of mine has been impacted by 40 quarters. She is 21 years old. She's at George Mason University getting her bachelor's and her master's. She's not able to access healthcare because of this policy, because she doesn't have 10 years of work experience. And then in the child welfare industry, this is impacting visitation from youth in foster care to their biological family. We know that's so important for family preservation. We also want to recognize that social workers are essential workers, and they are the frontline workers, and they need PPE just as anyone else. So we're looking at some captive, possibly federal captive funding of $500 million in emergency funding, and increasing the Chafee foster care program to $500 million to place a moratorium on youth that would be aging out of the foster care system during this time. So that's kind of a cross-cutting lens that we have so far.
Well, there's a lot in that answer to unpack. So why don't we start with the budget and long-term concerns. The government has put off any spending in programs until July. What are the long-term concerns that, and we'll start with you, Charvalla, that you might have as a nonprofit leader about where that budget's going to take you from a programming standpoint?
If I hope I understand your question. You're asking about long-term impacts of the virus and what that might look like in the nonprofit sector.
Right, that's right.
Well, I think one of the things that Chloe kind of pointed to is some of the deficiencies and inequities that we have seen during this virus outbreak have only been highlighted. They're not necessarily new, right? And so populations that are historically underserved are even more impacted because of the virus outbreak. And so from a long-term perspective, those that were closer or below federal poverty level or near that number of people is increasing. And so our focus will be, how do we help folks get back to work? How do we help them access education and training so that they can increase their income? United Way's focus in general is working across sector to create pathways out of poverty, and looking not just at those at or below the federal poverty level, but those who are working sometimes multiple jobs just to make ends meet and just are one crisis away from a downward financial spiral. And what we found is this has been that crisis, and the spiral has already begun. And so we are preparing for an overwhelming need to keep people in their homes, and to find new affordable housing options for folks. And then to Chloe's point, childcare is going to be essential to making sure that people have access to employment. Transportation will be essential to making sure people have access to employment and education.
Mm-hmm. Muted, you're muted.
I'm sorry. Do you have anything in particular that concerns that you might have about the governor's budget moving forward, from programming standpoint?
Well, many nonprofit organizations that receive public funding, a lot of times that funding is based on service delivery. If they've not been able to meet with people and provide those services, then those grant funds are impacted. And so there is concern there. Absolutely.
And Chloe, from a statewide standpoint, do you see the same concern?
For the nonprofit community, or for families and children particularly?
Families and children particularly.
Right. So in the childcare arena, there was $70 million in CARES Act funding to go to childcare providers. But what's important to note is that before the funding became available, 40% of childcare programs were closed. And many are worried about the reopening and whether they'll be able to hire staff. So the Center for American Progress estimated that 45% of Virginia's childcare industry could be impacted by permanent closure. We know, as Charvalla mentioned, when we look at inequities across the state, your rural areas, your rural and urban areas, or your urban areas, many of the community sectors, such as the faith community, our family day home centers, are the ones providing that childcare, or grandma and grandpa are providing that childcare. So in these communities where childcare is already so sparse, or there's childcare deserts that exist, it's so important to make sure the few centers that exist are kept open. For the healthcare arena, where we see telehealth and telemedicine have been prevalent and have really stepped up, but this is not a permanent policy. And so I've gotten feedback from community members that these are family sick leave, telehealth, telemedicine. These are things that could have been occurring all this time. And the question that presents itself is, will they still occur in superseding this pandemic? Are these still resources that we'll have? And from the child welfare component, we know that our schools act as the backbone of reporting as child abuse and neglect in other sectors, and these children are not getting interface with the teachers and et cetera during this time. And so one thing to note is they reported that hotlines numbers had went down, but recently from Virginia Department of Social Services, a conversation, the numbers have actually peaked. And yesterday I was on a phone call of children are even reporting their own child abuse now during this time. We were saddened to see the pausing of the school counselor funding that had passed this past General Assembly session, and increasing school counselors, but also to support that direct service time that's needed. This is an area that we still want to lift up, because we do feel like school counselors are still essential permanent adults for children during this time, and looking for triggers and signs of child abuse and neglect. So those are just a few things. As Charvalla mentioned, the inequities of the way that this has impacted the Black and Brown communities. We've seen that in the media. It's very important to shape those conversations in an equitable way. Some people look at the data and they respond with more racism. They see Black and Brown people not social distancing, and et cetera. We know that these inequities have occurred this entire time. They're further exacerbated by the pandemic. So how do we make sure the Black and Brown communities are further uplifted when it comes to the distribution of resources, to make sure underprivileged and disparaged children and families get what they need?
I'd like to stay with that point for a minute, because it's something that's come up multiple times about this particular pandemic putting the spotlight on existing inequities. And it's often talked about in a way that is a bit cold and a bit calculated. I was wondering if either of you could give some examples of things you're seeing in the community, just to highlight the personal nature of these inequities. Charvalla, can we start with you, and then Chloe, you as well?
Sure. one example is many of the nonprofit community or organizations that provide services to those with lifelong disabilities, intellectual delays, developmental disorders. They oftentimes run day programs that are not only essential for the person at the day program, but their families. And we know that folks with different abilities often are an underserved population. And so this has further exacerbated the lack of engagement that that population has, and their family no longer has that support as well. And so it creates this wider impact than just the person no longer going to the day program. That's one of the ways that we've seen this kind of play out. In the childcare arena, we were very fortunate to receive a very large donation of toilet paper that we distributed to local nonprofits earlier this week. And some of those were in-home childcare providers, smaller organizations. And one in particular was so grateful. She had to close her daycare for 2 days because she just didn't have toilet paper. And because of that donation, she was able to open again. And it's not just about her daycare, but about those families that rely on it to go to work every day. And those children who, like Chloe said, get to interface with other trusted adults. So those are just some of the things that we've seen on the peninsula.
Mm-hmm. So, I mean, there's so much to be said about this topic, and of course, I can't say all of it. I did share a resource. This May 3rd through the 9th was Resilience Week in Virginia. It was our first Resilience Week, and I did write a blog on the work of the Southside Trauma Informed Community Network as it relates to the intersection of race, culture, and poverty, which was a conference that they had not too long ago, but now the work is even more relevant today. When we look across every system and we talk about equity, we talk about the distribution of resources, what equity says is it's not equal. Being equal is not equal. Equity looks at how institutionalized racism impacts different sectors of the community disproportionately, particularly Black and Brown people. We need to give these communities more resources so that they can actually be equal. But one thing that I just want to say is that when we talk about this, the racial impact of the pandemic on Black and Brown communities, it's so important to not just highlight the communities as disparaged and vulnerable, because Black and Brown communities are actually very resilient and have been since the 400 years of slavery. And so when I talk about this topic, I try to highlight the resilience of the culture in addition to acknowledging the disparities that the culture faces. And so in the communities that I've worked with, particularly Southside, which is a predominantly Black and Brown community, that I've seen the resilience through community asset-based development. One example is a partnership between the United Way of Richmond and Petersburg and the South and the faith communities who, with the homeless shelters closing and the food pantries also closing, they've actually formed a partnership in housing people in motels and delivering food through the faith community and through funding that's come from grantees. So even though these communities are disparaged, they know and they have for many, many years been able to overcome those disparities. But at the state and federal level, I do believe that it will take an intervention of policy to ensure that it's not just the community taking care of itself, but it's Virginia and it's America taking care of these disparaged communities.
Well, I'd like to we have spoken with the director of the food bank on the peninsula in Virginia. She's told us that about 60% of the folks who are coming to the food bank now are people who are new to that need. And I wondered, and you spoke to it a little bit. I wondered about how this pandemic pushed people who are working maybe 2 jobs to make ends meet, how that's pushed people over the edge, if you will, and what kind of need that you see out there, and how long is it going to be with us? I mean, when we talked to the director of the food bank in this area, Hampton Roads, she said she expected this to be a long-term impact, 2 to 3 years. Is that what your United Way is seeing as well?
Absolutely. As I mentioned before, when we talk about poverty, we are also looking at those folks who don't qualify for government assistance like SNAP benefits. And they typically have to go and purchase their own food. And so sometimes if they miss an hour, a day of work, or need a car repair, or some minor derailment of their financial plan for the month, then they're left making very tough choices. And what we found with this pandemic, and I've talked to Karen also, and the partnerships that Chloe mentioned, the food bank has been phenomenal in reaching out to the faith community, to other nonprofits, to motels where folks are being sheltered right now, and really making sure that we are meeting the needs for those that otherwise we never would have met. And so what we're finding is there was a gap before that unemployment legislation made funding available to households. And so those folks got behind on bills, whether it was rent or their utilities. And in our local community, we've seen the suspension of court proceedings like the eviction process, but the courts will reopen. Landlords will ask for what's due them if folks haven't been able to pay that. Suspensions will be lifted for those delinquent utility bills. And so we're anticipating, and we've already mobilized some financial assistance through our partner organizations, so that folks who are not accustomed to navigating what can sometimes be a complicated system of services have one place that they can call and go to receive the financial assistance they need, as opposed to trying to figure out their way through something. And we hope that after this, they are the ones who are going back to work. They'll be paying taxes again, and really donating to our local nonprofit communities as well. And so we want to do everything we can to mitigate what we expect to be a long-term impact by helping folks get back to whatever level of financial security that we can get them to, through training and getting back to work.
Mm-hmm.
Chloe, you mentioned public policy. You said that there's some long-term public policy that needs to be addressed here because of the pandemic.
Right.
Before then, but the pandemic has made it more extreme. What public policies are you thinking need to be addressed in the near future?
Right. So our organization specializes in healthcare, mental health, child welfare, trauma-informed care, early care, education, etc. I wouldn't say it's just one public policy, but it's a series of different policies. We have 2 components. It's what do we need to lift up now to ensure families and children are getting what they need now? And there's a couple of policy packets around like the CARES Act funding that came out of childcare. We're looking at the HEROES Act to further uplift the childcare sector, SNAP, EBT. These are policies that can be uplifted now in order for the immediate need of children and families. And then in the long term, again, we've seen a lot of themes around food insecurity primarily and family economic security. So we're looking at policies like the temporary assistance for needy families that has cash assistance funding. This could be something, with Virginia's actually had a surplus in TANF funding because we haven't been using all of what's in the budget for TANF. It did increase this past General Assembly session, but this is another pocket of funding we could possibly look at moving forward. We need to make sure Medicaid at low-income families as well as the 40 quarters population has access. So this is something that will be uplifting again, like most likely in the General Assembly session. We'll continue to look at childcare, and then in the child welfare arena, continuing to promote normalcy and permanency. Particularly, we've been big proponents of kinship care funding, as well as preventing youth from aging out of foster care without any support. So it's things that didn't get passed or got paused this General Assembly session because of the pandemic that we're still going to advocate for in the future. But we've also seen our priorities shift to a lot of themes around family economic security, and that really gets at the heart of a lot of the financial insecurities that we're seeing during this time.
What's your, just one final thought, which is how long do you think the impact on families in Virginia and children in Virginia, how long do you think that's going to last from the pandemic?
That's a really good question, and we really can't say, and that's a lot of the uncertainty that comes with the pandemic. With Virginia reopening, we have children and family members in mind. Charvalla mentioned that Alice population who don't quite qualify for benefits, but are still in that gap. And so children and families are put in a tough situation. Do I go back to work? Do I put my children at risk? Do I pay my bills? Do I stay home and possibly not qualify for unemployment? And all of these can have, it's a sensitive topic because they can have very long lasting impacts on these populations that will take even longer to recover. So yes, we don't know, but what we do now will really inform how long the impact of this is.
Well, ladies, we have had a very interesting conversation today. There are a lot of people in need out there today, and I wanted to tell you thank you for joining us today, for sharing your thoughts and insights. And I hope that the audience has gotten some interesting information about how the pandemic is affecting the communities in Virginia. Thank you.
Thank you.
Thank you, Marisa. Thank you again to Chloe Edwards and Charvalla West. We will be sure and include in the description to this video links to their websites. Please do go check those out, see what's going on there, and see if there's ways to help. We'll also include a link to the blog post that Chloe mentioned as well, in case you're interested in more information on that. To those watching this, we appreciate your time and attention. If you've watched this far, it'd be great if you'd like this video. You'd help us out a lot. And certainly subscribe to this channel. There'll be more from We Virginians coming soon. For now, thank you very much.
Thank you.
Thank you.